Dear students, welcome to EPG Pathshala. This is Dr. A.G. Sinha, a professor in Department of Physiotherapy, Punjabi University, Patiala. In this module, we shall talk about the effects of different type of therapeutic exercises. Dear friends, in the previous modules we have discussed that when exercise is used for treatment purpose, it is known as therapeutic exercise. Exercise is essentially the repetition of movement which can be confined to a single joint, or it may involve the movement of many joints. Depending upon whether the movement is performed by muscle contraction or by some passive force, the exercises can be categorized as active exercise and passive exercise. Each category of exercise has some specific effect and uses. A familiarity with the effect of various subgroups of active and passive exercise helps in judicious use of exercise in a therapeutic program. In fact, designing of a therapeutic exercise regime for a given condition requires finding out a specific deficiency and selecting the exercises that can ameliorate that deficiency. At this point, it is important to highlight that performing wrong exercise is like taking wrong medicine. Therefore, it is important to ensure that the therapeutic exercises are designed by a person who not only knows the technical aspect of exercise but also have a detailed knowledge about the effect and uses of the different categories of exercise. The focus of this module is the effect and uses of different subgroups of therapeutic exercises. The specific learning objectives are: understand difference between effects of active and passive exercises, understand the effect and use of free exercise, assisted exercise and resisted exercise, know the effects of relaxed passive movement and forced passive movement, understand the effects of stretching exercise, and finally understand the role of passive movement in the health and diseases. In the previous modules, we have discussed that exercises are essentially the repetition of movement which can either be confined to single joint or multiple joints. When exercises are used for the treatment and prevention of injuries and diseases, they are called therapeutic exercises. We have also learnt that depending upon whether the movement is performed by the person himself or by some external means, the exercise can be broadly divided into the categories of active exercise and passive exercise, each having different subgroups. Each category of exercise has some specific effects and uses. An acquaintance with the effects of various subgroups of active and passive exercise helps in judicious use of exercise in health and rehabilitation. In fact, designing a therapeutic exercise regime for a given condition requires the ability to find out the specific deficiency and selecting the exercise that can ameliorate the deficiency and fulfill the need and requirement. It is important to ensure that therapeutic exercises are designed by a person who has adequate knowledge of not only the techniques of exercise but also the effects of these exercises. He should also have the capability of assessing the physical deficits. At this point, it is important to highlight that performing a wrong exercise will have the same adverse effect as taking wrong medicine. In this module, we shall study the effects and uses of different types of active and passive exercises. Active movement is the result of voluntary contraction of muscle. That technique of exercise which utilizes the movement produced or controlled by voluntary action of muscle acting in opposition to an external force can be termed as active exercise. The internal force of muscular contraction can be assisted or resisted by a variety of forces. The force generated by the contraction of other muscles, inertia of body parts can act as an internal force, whereas the external forces can be exerted by the weights, dumbbell, spring, exercising equipment. However, the most important external force that affects the human motion is the force of gravity that always works to pull the body toward the earth. Therefore, even standing erect or sitting unsupported require the active contraction of several muscle groups, and these activities can also be termed as active exercises. Active exercise require efforts of patient. If the patient is not willing, the exercise cannot be performed. So, to ensure effective execution and compliance, patient education plays a very important role. We have discussed that on the basis of amount of assistance or resistance applied to movement, the active exercises can be classified as free, assisted, or resisted exercise. We shall now analyze the effect of these different categories of active exercises and see how they are utilized in a therapeutic setup. The greatest advantage of free exercise that they do not require any equipment and can be performed independently once learned. The only external force that acts on the body is the force of gravity, and by suitably selecting the starting position, the force of gravity can be used to either provide assistance or resistance to the exercising movement. This character of free exercise make it a versatile tool of conditioning and fitness program. The effects of free exercises are extensive and depends on the goal of exercise, intensity, type and duration. In nutshell, all the benefits obtained by exercise in general can be produced by free exercises. Free exercises are extensively used for increasing the range of motion of a joint, increasing the strength of muscle, and improving the coordination and balance. In addition, the free exercises are the mainstay of aerobic exercise program that seek to improve the efficiency of cardiopulmonary system. The detailed discussion on the effects of free exercise is the subject matter of exercise physiology. Here we shall discuss some of the effects of free exercises that are commonly used in the treatment of diseases and disorders. The free exercises are extensively used for maintaining an improvement range of motion, maintain an improvement strength of muscle, to promote balance and equilibrium, improvement of cardiopulmonary endurance. Besides that, active free exercises also exert a number of psychological effects. Now we shall discuss in detail the basis behind each of these therapeutic uses of free exercises. The exercises performed in full range of motion helps maintain the range of motion available at a joint. In case of restricted motion, the rhythmic pendulum-like movement of the affected joint with slight overpressure at the end of available range serves to increase the range of motion. In free exercises designed to increase the range of motion, the starting position is selected in such a way that the force of gravity either assists the motion or movement takes place in the plane of gravity so that gravity does not oppose the movement. Swinging arm in half-stooped position is a free exercise that helps increase the range of motion of shoulder and is often used in the management of frozen shoulder. The exercise used during active stretching also fall in the category of free exercises. The active contraction of muscle is the prerequisite for maintenance of muscular strength, power and endurance. Free exercise, by virtue of using active contraction, is capable of maintaining muscular strength. The increase in strength of muscle takes place when a muscle works against a resistance. This resistance may be provided to a muscle during free exercise by selecting a position where movement is performed against own body weight, or by varying the speed of movement. Performing a movement at slower and faster speed than the natural speed of movement increases the force of contraction of muscle. When a movement is performed against the gravity, the body weight acts as a resistance. The repetition of a given movement also serves to maintain the muscle power. In injuries of musculoskeletal system, immobilization of involved segment is required in the initial stages of management. Performing repeated isometric contraction several times a day serves to maintain the muscle strength. Maintenance of balance requires coordinated efforts of many muscle groups that work in close cooperation to keep the center of gravity of the body over the base. The coordination improves in response to repetition of a movement. The repetitive performance of an act actively improves the muscular coordination that serves to improve the balance and increase the efficiency of movement. Normally, we can hardly stand on one leg for more than few seconds. But if we repeat this activity, that means if we start standing on one leg repeatedly, then over a few days, our ability to stand on one leg and our duration of standing on one leg improves tremendously. For improving the balance, the dimension of base of support during the movement should also be gradually reduced. General free exercises such as walking, running, swimming are also known as aerobic exercises. These exercises are used to improve the efficiency of cardiopulmonary system to supply oxygen to working muscle groups. The aerobic exercises produce several immediate and long-term changes in the structure and function of cardiorespiratory system, which finds their application in the management of several diseases affecting circulatory, respiratory, and metabolic system. The detailed study of the effects of aerobic exercise is the subject matter of exercise physiology. Nevertheless, at this point, it would be pertinent to say that some metabolic effects of aerobic exercise, such as reduction of fat level and reduction of sugar level, makes it a powerful non-pharmacological tool in managing the lifestyle-induced metabolic diseases. The main variables associated with aerobic exercises are speed and duration of activity. It is the speed of movement that makes an activity aerobic or anaerobic. Running at a very fast pace is an anaerobic activity, whereas slow walking or jogging is the example of aerobic activity. In the terminology of exercise science, the speed of activity is termed as intensity of exercise, whereas the duration of activity is referred as the volume of exercise. Suitable adjustment of intensity and volume according to the ability of person constitutes the core of designing aerobic exercise program, which finds a much wider application not only in sports training but also in the rehabilitation of a debilitated person. The effect of free exercise on the psychological parameters are innumerable. Successful completion of a free exercise gives confidence and encouragement to take another activity, and it inculcates a person to adopt an active lifestyle. The excitement and joy of performing motor activity is the main reason of participation in sports. Rhythmic free exercises also induce relaxation and help in combating the negative effect of stress and anxiety. Now we shall talk about the effects of assisted exercises. Assisted exercise is used in the very early stage of strengthening of very weak muscle. Active voluntary contraction of muscle contributes to strengthening of muscle. As muscle starts gaining strength, the amount of assistance applied is gradually reduced, and ultimately the person is able to perform the movement without any assistance. Besides strengthening of the weak muscles, assisted exercise keep alive the memory of the pattern of movement and maintain the range of motion of the affected joint. The assistance and support provided during exercise help allay the fear and improves the confidence of patient. The main effects of resisted exercise are strengthening and hypertrophy of muscle. Therefore, this type of exercise is also known as strength training. The strength and size of a muscle increases when it works against a resistance. The amount of muscle contraction and the resulting force is proportional to the amount of resistive force. In other words, more is the resistance, more is the force, and the more is the amount of contraction of muscle. A muscle consists of several motor units. The force of contraction depends on how many motor units contract during a muscle contraction. The number of motor units working at a given time depends on the amount of resistance a muscle is required to overcome, and it increases in proportion to the applied resistance. This phenomena is called progressive resistance. While working against less resistance, all the motor units do not contract. In order to maximally recruit all motor units, a muscle should be made to contract against the maximal possible resistance. Repetitive contraction against maximum resistance lead to increase in the strength and size of muscle. This principle of strengthening finds its application in restoration of strength of weak muscle. Further, the resisted exercise are commonly used to increase the bulk of a normal healthy muscle in bodybuilding and fitness programs. By restoring the strength of weak muscle, the resisted exercise help to correct the muscle imbalance and contributes to efficient coordinated movement. Resisted exercise also increases the blood pressure, and therefore these exercises should be used in caution with the person with hypertension. Now we shall talk about the effect and use of the passive exercises. Movement produced in the joint by external force, not by the contraction of muscle, is the cornerstone of passive exercise. Passive exercises are used in conditions where voluntary movement is not possible or permitted. As stated in the previous module, the main focus of this group of exercise is mobility of joint and flexibility of soft tissue. The unrestricted pain-free range of motion is one of the basic prerequisites to perform a functional activity. Flexibility or ability to move a segment in various directions is often referred as the range of motion. The range of motion available within the joint depends primarily on three factors: structural architecture of bone and joint, amount of motion available within the joint, and the length and extensibility of surrounding soft tissue. The restriction to the anatomical permissible range of motion may result because of injury and pain, adhesion and tightness and contracture of the soft tissue surrounding the joints. In order to understand how passive exercises helps improve the flexibility, we need to understand the nature of the soft tissue. Soft tissue of the body are viscoelastic structure that are capable of changing its length in response to mechanical stress. Body tissue display the property of elasticity. That means they can be deformed, either stretched or compressed up to certain limit by application of stress. and after the removal of stress, the tissue come back to its original position. Plasticity refers to permanent deformation of structure in response to mechanical stress. The soft tissue of our body display the property of viscoelasticity, where the change in the length takes place in response to low-grade prolonged stress. That means if we maintain a low-grade stress for a prolonged period of time, we can change the length of the soft tissue permanently. In fact, human body is a dynamic structure that is capable of changing in its structure in response to the changing environmental and functional stress. As a result, the soft tissue of body often gets shortened or lengthened in response to the postural and functional stress. The alteration in the length of soft tissue affects the ease of movement and is manifested in the form of reduced range of motion, we commonly call it as stiffness, and pain during the movement. There are two major approaches to passive exercise. One focusing on the motion available within a joint, and second dealing with the shortening and tightness of the soft tissue. The passive exercise approach dealing with the motion available within a joint are collectively known as passive movement, whereas the passive exercise dealing with the shortness and tightness of the soft tissue are known as stretching. The ultimate goal of both groups of passive exercise is to keep the body flexible. The two main techniques of passive exercise, as we know, are relaxed passive movement and forced passive movement. The forced passive movement is also known as manipulation. Since the passive exercise involve application of external force, adequate care should be exercised in performing these techniques. The inadvertent use and careless execution may produce damage to the tissue. The most significant factor that influences the effects of these techniques is the skill and knowledge of the physiotherapist. The person performing these techniques should have a thorough knowledge of musculoskeletal anatomy and a good palpation skills. Now we shall talk about the effects and use of relaxed passive movement. Movement within the limit of pain is the characteristic feature of relaxed passive movement, and no attempt is made in this technique to move the joint beyond the available range. The relaxed passive movements are used when a person is not able to actively move a segment of body. Sometimes a person can move the segment actively, but he is not allowed to do so due to harmful effect of active contraction of muscle. During early stage of injury and healing of bone and soft tissue, active movement may damage the repairing structures, and therefore active movement is not permitted during these times. During complete bed rest, active movement is also not allowed, as it may produce adverse effect on the cardiopulmonary and autonomic system. In these situations, relaxed passive movement is employed to maintain the joint range of motion, prevent adhesion formation, and preserve the memory of pattern of movement. Movement through full range help to maintain the mechanical elasticity of muscle and soft tissue. Relaxed passive movement also helps in improving to a slighter extent the venous and lymphatic drainage. The another important effect of relaxed passive movement is relaxation. The rhythmic relaxed passive movement of a limb produce a soothing effect and induce relaxation and sleep, and it can be a useful technique in facilitating recovery of a tired athlete. Nowadays we use some mechanical devices for producing relaxed passive movement. The continuous passive motion, or CPM, it produces the physiological movement, and the mechanical traction, a commonly used modality for the treatment of neck pain and spine pain. It produces accessory movement of the spinal joint. Research has indicated role of passive movement in early repair of cartilage, ligament and tendon. Passive movement enhances circulation of synovial fluid and facilitate diffusion of nutritive material across the joint cartilage and play a role in maintaining the integrity of joint cartilage. This observation has led to development of continuous passive motion, a machine that produced controlled passive movement of a joint of a fully supported segment continuously for many hours. The machine has an electric motor that produces a controlled motion of the mechanical joint of the machine. CPM is now increasingly used in the early stage of management of certain operative procedures of cartilage, ligament and tendon. Another mechanical device that produces passive movement is traction. While CPM produces physiological movement, traction produces the accessory movement of a spinal joint. It applies rhythmic force that attempts to pull the joint surface away from each other. Mechanical traction is a commonly used modality in the treatment of neck pain and back pain. Forced passive movement or joint manipulation techniques seek to increase the range of a stiff joint. These techniques attempt to move the joint beyond the available range. There are several physiotherapeutic approaches that exclusively use this technique for the reduction of mechanical pain and restoration of movement and function. The use of passive movement in the treatment of musculoskeletal dysfunction, in fact, is a very vast field comprising of several treatment approaches. And these approaches are advanced by authorities like Maitland, Kelton Bones, Greaves, Syriacs. Each passive exercise approach has different philosophy with regards to the genesis of musculoskeletal problem, and the treatment techniques used in each approach are not same. The essential feature of all these approaches of passive treatment is the identification of the joint having restriction in the range of either physiological or accessory movement, and then they use controlled passive movement to increase the range of the stiff joint. While the focus of passive movement is on restoration of physiological and accessory movement of a joint, stretching is directed toward elongation of soft tissue. Stretching means applying force to increase the length. Stretching exercises are used to lengthen the soft tissue such as muscle, tendon, ligaments and skin beyond their resting length. There are 4 uses of stretching: in the treatment of injury, in the prevention of injury, as a method of relaxation, and as a treatment technique for correction of contracture and deformity. Pain, restricted mobility and immobilization during injury often brings about a reduction in the resting length of soft tissue and makes the movement inefficient. Stretching is used most often in these cases as a part of overall treatment. Stretching is also used by the athletes as a part of warm-up and cool-down practice. The shortened muscle demonstrate less tension during contraction, and restoration of normal resting length of tissue increases the efficiency of skilled movement and reduces the likelihood of injury. Application of low intensity external force over a prolonged period is often used for the correction of deformity. The external force in these situations is applied through positioning of patient in such a way that a gravity applies a downward pull to the shortened structure. Serial casting is also a specialized type of prolonged stretching, where a part is kept immobilized in a plaster cast in the maximum lengthened position. After some day, the cast is removed and part is taken to a new length and is immobilized again. This process is repeated till the deformity gets corrected. The study of the effects of therapeutic exercise is in fact the study of biomechanics and physiology of human movement. We have learnt that active exercise utilize the movement produced by the voluntary contraction of the muscles, and they require the voluntary effort of the patient. The effects of free active exercises are numerous, and they are the subject matter of exercise physiology. Assistive exercises are used in the early stages of strengthening of very weak muscles. Resisted exercises are primarily used for increasing the strength and size of muscle fibers. Passive exercise do not involve muscle contraction, and therefore they would have no effect on the strength of muscle. In fact, the passive exercises are mainly focused on the mobility of joint and the soft tissue. The two techniques of passive exercises, relaxed passive movement and forced passive movement, are directed to restore the joint range of motion, whereas the stretching exercises are used for the mobility of the soft tissue of the body. Various approaches of forced passive movement. The utilization of the forced passive movement of physiological and accessory movement is the mainstay of various manual therapy approach. These approaches are now increasingly becoming common to treat the pain and dysfunction associated with the physical inactivity and stiffness. The restoration of soft tissue length is the specific effect of stretching that finds its use both in treatment and prevention of injuries. Thank you.